Hey there, everybody, and welcome to this live Monday Ask Me Anything question. I am glad to see Trinity Blessed member. Welcome. Patty, if you are listening, thank you very much for becoming a member. We do have a few things that are in the membership categories right now. People who are silver members get access to the PDFs of the PowerPoints, and people who are gold members also get access to self-help worksheets that are associated with that week's PowerPoint. So, for what it's worth. But I hope everybody is having an absolutely fabulous beginning to their holiday week. The Christmas holiday week. I know those of you who are Jewish started celebrating Hanukkah long ago. So I hope you are having a good Hanukkah. Hello, Crystal. Hello, Adriana. And yes, Mojo is sort of beside himself today. So, Roller Girl, I've got to make that connection. Hello, George. And hello, Kyle, I think. I am having an absolutely fabulous day today. So thank you very much. I am here to answer the questions you have about mental health. So one of the questions George asks is, what are some activities that increase dopamine? And that's actually a pretty involved question, believe it or not. Dopamine is our motivation chemical. When we do something that helps us survive, either it's pleasurable or it helps us escape pain, we get dopamine released to say, either keep doing it or I want to do that again. Remember to do that next time. So dopamine is a really beneficial chemical. However, there are a lot of ways that dopamine can be deficient, if you will, in people. A lot of people with addictions experience a lack of dopamine, if you will, or lack of dopamine signaling is probably a better way to put it, because their receptors have been bombarded so much that they've kind of shut down. And so it is for people with addictions, it's actually counterintuitive, but one of the first things we need to do is actually help them lower their dopamine drive, if you will, because we want to allow those nerves, receptors to actually sort of heal. So one of the things that I would say before I start telling you things to do to increase dopamine is take a look at your lifestyle. Are you involved in a lot of adrenaline-producing activities that may be causing your dopaminergic neurons to be overstimulated? If so, they may have started sort of shutting down. Just like when people drink alcohol, initially, they can get buzzed off just a little bit, and that's how our body normally works. Initially, it just takes a little bit of dopamine to get us going. But if you continuously drink alcohol or frequently drink alcohol, the receptors become less active, less stimulated when you drink the same amount of alcohol. So if the receptors are overstimulated, we want to give them a break through relaxation, through calming activities, through creating a sense of safety and empowerment, through finding that sort of Zen period, if you will. Dopamine is also one of those neurochemicals that people associate with motivation. And yeah, it is our motivation neurochemical. And when your motivation's low, we need to, again, look at why that is. Is it dopamine or is it something else? Is your body saying, I'm done, I'm exhausted, I'm not getting enough sleep, I'm nutritionally deficient, I'm under chronic stress, and I just can't do it anymore. So again, looking at what else is going on that may be inhibiting motivation. So those are the things that I would say that people really need to keep in mind before they start necessarily trying to increase dopamine. But if you do have low levels of motivation, it's helpful to identify whether it's low levels of motivation across the board or low levels of motivation for certain things like work or cleaning the house or things that just really aren't fun. Dopamine is increased when we have successes. So if you set and achieve small goals, our brain says, hey, we did it. Maybe I can do it again. So setting and achieving small goals is one way to increase dopamine. Engaging in things that you enjoy obviously will increase dopamine because your body goes, I want to do that again. Making sure you are eating a healthy anti-inflammatory diet can also help improve dopamine signaling in the body indirectly because you're reducing inflammation, you're reducing stress on the body. So there's more, so the system is tuned more towards motivation. You've got more energy to devote to having motivation to do things instead of just heal your body. Pleasure-inducing activities are going to increase dopamine to a certain extent, but are you overwhelming the dopamine system that's already saying I'm overstimulated and I actually need a break? So I would encourage you to think about what is causing the lack of motivation in your system. And remember that dopamine is also involved or interrelated with all your other hormones. If serotonin's low, if gonadal hormones are low, if norepinephrine is low, it will affect the availability of dopamine in your system. So I would encourage you to look bigger, to figure out exactly what you're trying to target and whether dopamine itself is actually the problem or whether there's an underlying issue that is causing whatever the problem is. If you feel like you've got disorganized attachment, that's another question that Adriana put out. I'm not sure who added that, but that's cool. Attachment is a big thing. And we're actually, interestingly enough, doing a video on oxytocin on Wednesday, which is our tend and defend hormone. It's not exactly our bonding hormone. But the short version is when you have insecure attachment, whether that's anxious attachment, avoidant attachment, or disorganized attachment, when you feel insecure in relationships, it's very stressful. And that ongoing stress is amplified if you don't believe that people are there to help you, if you don't believe that you've got any support, which is why we often see increased physical as well as mental health issues in people with attachment trauma, and those issues can show up or persevere years, decades, even after the relationship is over, if the person doesn't feel safe in their relationships. So back to your question. Disorganized attachment means that sometimes you feel anxious, sometimes you feel like, oh my gosh, my life is going to end if I don't have this person in my life. I've got to do whatever I can to keep them here. I'm worried they're going to abandon me. And then other times, it's like, you know what? No. I don't have the energy. I don't have the desire. People go away. You bother me. I'd rather spend time with my dog. So we've got two different things. And you can have different reactions to the same person. So sometimes you may feel overwhelmed and frantic to keep that person from abandoning you. And then you may hit a wall at a certain point, or something may happen and you may almost feel like you turned off a switch. And it's like, you know what? You're not worth the effort. I don't have the time. I don't have the energy. Go away. I don't need you. And then 2 minutes later, you're frantic to have them back in your life again. And that's your protective mechanism going back and forth saying, I really feel like I need you in my life, but oh my gosh, you're so overwhelming. Maybe I can't manage this, but I need you in my life. And that's probably a pattern that developed over time, especially if the initial traumas happened when you were a child, because children need their adults in their life in order to help them survive. So the child is like, please don't leave me. I can't survive without you. But at the same time, they're feeling like, oh my goodness, you are so completely overwhelming and you just make me miserable and I want to put up a wall. And this constant push and pull. In order to heal that, understanding what triggers different feelings can be somewhat helpful. I would encourage you to explore, what does it look like to feel safe in a relationship? And maybe you've never had a relationship with another person in which you felt safe. And other people, unfortunately, we can't control. So they are kind of a wild card, if you will. But you can control your relationship with yourself. So when I work with a lot of people, adults who have insecure attachment, we basically start over and we start reparenting that inner child and saying, okay, as you've grown up or in these relationships, you felt abandoned, you felt unsupported, whatever happened, it was an unsafe situation where you felt unsafe and powerless, and you didn't feel like you were able to really protect yourself. Therefore, now, as an adult, what can you do to keep yourself safe? What do you need from other people? I mean, as an adult, you can feed yourself, you can shop for yourself, you can pay your own bills. There's a lot of stuff, most stuff you can do for yourself without relying on someone else. Now, that goes towards the avoidant edge of attachment. And I understand that. But recognizing, hey, I'm powerful and I do have the power to keep myself safe. And starting to develop that relationship and learning what a safe relationship looks like, one that is consistent, attentive, responsive, encouraging, and safe. Developing that first. And safe is huge because in our relationship with ourselves, we're also kind of developing a relationship with that inner critic because none of us can get rid of it completely. And that inner critic plays tapes, if you will, or says things to us that are unkind. A lot of times they're things that other people have said to us that were unkind. And we need to feel like we can protect ourselves from those unkind words. I need to feel safe in my own skin before I can feel safe around other people. I need to feel like I can manage, maybe not eliminate or completely silence, but I can manage that inner critic and recognize that what it's saying is not necessarily accurate. If it says that I'm not lovable, okay, do I believe that? You know, when I'm creating a safe environment in my own skin, in my own head, I need to verify everything I tell myself and say, is that something I actually believe? Or is that a tape that somebody else programmed that I continue to hold on to? If I don't believe it, then I'm going to erase that tape. I'm going to say, no, that's not something I believe. So creating that safety is the first step because a lot of insecure attachment has to do with feeling that we can't protect ourselves around people and people in large part are not trustworthy. We need to know that we are trustworthy to ourselves. We can keep ourselves safe. We can help that inner child who says, everybody I've ever been around has let me down. We can help that inner child say, all right, up until now, people I've been around have let me down, but I am not going to let myself down. And once I start feeling safe there, then I can start reaching out and trying to learn how to develop trust with other people. Small at first, very small at first. Understanding that, yes, I would like them to be in my life. I would like to do these things with them, but I don't need them in order to survive. If they leave, okay, it is what it is, and I can't control them. But that's way down the line. Developing that secure attachment with self, very key to initial healing, and recognizing that you can keep yourself safe, even in the relationships you have now. Look at the relationships you have. What things do people do in those relationships that help you feel safe, that help you feel loved? What do people do in those relationships that don't? They make you feel unsafe or abandoned or rejected or criticized. Okay. Those are the behaviors and things that we're looking at. And then it's going through each one of those and evaluating them. And it can be a tedious process, but determining, maybe you have a friend, Sally, and Sally overall is very supportive and welcoming, and I love spending time with her. But then sometimes she just flakes on me, and it triggers my anxiety that I'm being abandoned. Okay, if that happens, that's one of those things. Whatever she's doing that means she flakes on you, that's one of those things that triggers your fear of abandonment. Does it mean she's abandoning you? Not necessarily, but it triggers that feeling. So getting that in check with the facts in this context at this time, and then in secure relationships, consistent, attentive, and responsive. So you're checking that feeling, you're evaluating the facts, and if she's not actually doing it, if it's just kind of her way, maybe she flakes on everybody, okay, doesn't mean it's right. That's something that you can do responsively to address with her and say, hey, Sally, if you are not going to be able to make lunch, I'd really appreciate it if you would call me ahead of time instead of waiting until I'm at the restaurant and texting me or something. Whatever it is. But start with those friends. Remember your boundaries. Just like a house, you're not going to let some stranger come into your living room, most likely. You're not going to let somebody that you don't trust in too close to your physical proximity, to your emotions, to your thoughts. That's not something you're going to do right away. They earn that trust by, and you have to define what that looks like. What do they need to do in order to earn your trust? How does somebody that lives across the street from you become a friend? Just because they live across the street doesn't mean you want to invite them over and give them a key to your house and let them have coffee. Maybe not in that order. It means that they're another human being living across the street. So how do you develop trust with them? Maybe you start out by waving to them in the morning, and over time, maybe you see them outside, you start talking, you get to know each other, and then eventually you say, hey, seems like we have a lot in common, whatever. Would you like to come over for dinner? But you're gradually developing trust. You're not going to go over them to their house the first day you move into the neighborhood and say, hey, let me come in and tell you all about my life and who I am. You're just not going to do that. So we do naturally slowly develop trust in our relationships if we're open to them at all. And again, understanding that disorganized attachment is often a pattern that developed in prior relationships where it was somebody you felt you needed in your life for some reason, but then it would get overwhelming and you would just try to take control and protect yourself, but then you felt out of control, you felt isolated or whatever, and then you wanted them back again. You're like, okay, you're right, I can't live without you. And so it was this constant push-pull where you never felt safe. Okie dokie, where are we at? How to identify a manic episode. By definition, a manic episode is when someone is much more energetic, euphoric than they normally are. I mean, you see this person and you're like, whoa, you've had a pot or two too much coffee today, and then some. That's one sign. They may also talk a lot and talk quickly, and that's not normal for them. I mean, I talk a lot and talk quickly, and I'm not manic. It's just how I am. But suddenly they start talking a lot and quickly, and their associations may be very loose. They just keep on talking, and they're all over the place. They tend to be much more impulsive. When people are in a manic episode, that think filter, it's not there. It's not there in what they say. It's not there in what they do. They just get a desire to do something, and it's like, okay, I'm going to go do it. Those would be the biggest signs that somebody is in a manic episode. A lot of times, people who are in a manic episode also have a reduced need for sleep. But as with all mental health diagnoses, there isn't one set list of symptoms that everyone has. It's some combination of a variety of symptoms. Not everybody who's in a manic episode will talk a lot. Some of them will become very intense on their work. I've worked with a couple of people who, one was a nuclear scientist, and when he would get into his manic episode, his mind would start going like a bazillion miles a minute, and he would get intense in his work. And sometimes it wouldn't be 100% accurate because it was on the borderline of psychotic sometimes, but he wasn't talking a lot. His brain was just working consistently. So my point is, what you're looking for is a change in behavior that's markedly different than what is normal for that person, and there's no identifying precipitant. I mean, if somebody just got engaged, they're going to be really excited, and they may not, they may stay up for a day or so celebrating or something. It doesn't mean they're manic. It means they're excited. So we need to take everything into consideration in context. When you're working with Trinity, tell me a little bit more about mentally ill. Are you talking about somebody who is experiencing psychosis, or are you talking about somebody who has depression, anxiety, some sort of mood or personality disorder? That would be helpful to clarify. Until then, I'm going to answer. It's really important when we're working with people in general to recognize empathy is about understanding where they're coming from, but not getting stuck there. The analogy that my mentor made was sympathy is having somebody stuck in a well where it's cold and it's dark and it's wet and they're freezing, and leaning down over the well and going, gee, must suck to be down there. It looks pretty dark and cold and wet. We're really not getting it. We're saying it, but we're not getting it. Empathy is when we strap on rappelling gear and go down in that well with them. Now, we've got the rappelling gear on, so anytime we want, we can pull ourselves back out and say, okay, I've had enough cold, dark, and wet. Thank you. But we can get down there with them for a minute and feel what it's like. So empathy in and of itself can be tiring, but the important thing is having that rappelling gear available to help you pull yourself out of it. And yes, if you're a therapist, your work is exhausting. I have long said, and the supervisees I work with, I strongly advise them, unless their agency requires it, I strongly advise them never to do more than 6 hours of individual therapy in any given day. It's just too mentally draining. You can do an assessment and a couple of groups and maybe 2 or 3 individuals. That's not so bad. But individual therapy is intense and it requires a lot of focus, and that empathy does require a lot out of us emotionally and cognitively, and that impacts us physically. So recognizing that what we do, a lot of people think we're just, it's like having coffee with people all day long. That is not it at all. That is not it at all. If we're doing our job appropriately, it can be exhausting. It can be challenging for a lot of us, going back to that understanding from their perspective. When you're working with somebody who perceives the world through an entirely different lens, maybe it's a different cultural lens, or more often it's a different cognitive lens. Theirs is riddled with cognitive distortions. They think everything and always and never, and they personalize, and there's a lot of stuff. And not being objective to the situation, we can see, maybe that wasn't really personal. Maybe that was something that had to do with him. We can see a lot of different things because we are not them. We're not in their space. So if we get in their space and imagine what it must be like to view the world through that lens, it's exhausting. We will start to feel exhausted like they do. But that's when we need to make sure we debrief, if you will. So setting boundaries, taking good care of yourself, that's really important. If you're getting exhausted when you're with your clients, getting supervision can be really helpful because that will help you debrief some. Talk with your supervisor if you're not in private practice. You may have too many high acuity clients or high needs clients. When I worked in community behavioral health, I would always make sure when I was assigning clients to different therapists that I didn't, for example, assign one therapist to have every single client that was in residence that had a personality disorder, because people with personality disorders typically have much more intense and acute presentations. So I would try to spread that out some. Now, I did have one person who actually preferred working with people with personality disorders. So, that was no problem. But if you find you're getting too many clients that are too intense, you may need to ask your supervisor to shake it up a little bit. Say, I can only handle so many of this type of client. Examine what is frustrating you. You say it's challenging and redundant. And recognizing that people will keep repeating something until they feel heard. And if somebody is being, quote, resistant, hate that word, but I'll use it. It often means either they don't see there's a problem, they don't see where their thinking is inaccurate or what they're doing is unhelpful. They just don't see it. They don't have the skills to change it. They may not feel like change is possible, even if, maybe they have an addiction. And maybe they know they have an addiction, but they're resistant to treatment because they're like, treatment ain't going to do me any good. It's just a waste of time and money. Okay. So they don't know they've got a problem. They don't have the skills to address it. So we can't expect them to address it. They don't know how to implement the skills that we're using. And the best analogy I can make for this, I was never a good math student, was to take people back to when they were in school and they were taking math class. And the math teacher would just write things up. And of course, this comes next and this comes next. And this is how you solve this problem. And bada bing, it's done. I'm still back on, okay, what were the inputs? It took me more time. So we may be teaching people skills like downregulation skills that seem super easy to us and super easy to integrate because we use them every single day. But for the person who doesn't, it's like learning a whole new language. And so we may be expecting them to achieve a level of mastery far faster than is even reasonable. And, that's certainly something that we need to take a look at and examine. All right, we worked on downregulation skills last session, yet you seem to be continuing to have problems with downregulation skills. What is keeping you from feeling effective or from being able to implement these? For a lot of my clients that I've worked with, the biggest thing is there's no stop. They go from they're triggered to they're feeling out of control. It doesn't even occur to them once they're triggered to try to use the downregulation skills. So we need to figure out how to put a pause in there and help them implement those skills. I view therapy with most people as sort of like detective work, trying to understand what triggers certain behaviors and certain feelings and trying to help them develop a plan to, once they've learned new skills or identified different patterns, develop a plan to implement those in a way that's meaningful. And if they're not doing it, then I want to take a step back and say, all right, what's different? What is keeping this person from being able to implement it? And I'm going to do that with the client. I'm going to say, it doesn't seem like we're making any headway here. Tell me a little bit about what's going on or what's working or what's not working, because what works for me may not work for them. I've always defaulted to the example of journaling. I didn't journal when I was a 16-year-old girl. I'm not going to journal now. It's just not something that I'm motivated to do. And it's always been like pulling teeth. I've tried to do it a couple of times and it's lasted a day. So if I tell people to journal their feelings, I always couch it with, if that works for you. And we talk about what might work instead of just canned interventions. A lot of people, unfortunately, that we see in clinic are going to struggle with very similar issues. So it can feel redundant between patients because it's like, okay, another person who is experiencing a lot of social anxiety and CPTSD. And yeah, it is. Most of what we're going to see is very often redundant between clients. And that can be heartbreaking to recognize how many people out there are actually touched by trauma and struggling with trauma. On the other hand, we can learn from each client. We can learn as we see one person start to improve or see things that work for them, then that may give us an idea. It's like, oh, okay, Tom has been kind of stuck right here. I wonder if this would work over there. Obviously, you can't breach HIPAA or confidentiality or anything. But I've learned most of the skills and tools that I've learned. I may have learned a little bit from a book, but I've learned a lot of it by applying them with clients, not to clients, with clients, and helping them or having them help me learn what works best for them in terms of applying that specific technique. In terms of trying to control recklessness during manic episodes, it's really important to talk with your care team and develop a plan with people who are safe that you can rely on if you feel like you've got a manic episode coming on, or people that you see every day who would be able to notice if you were beginning a manic episode that could step in and help you take steps to manage your behavior when you're manic. And I don't know what behaviors those are, but generally when I have people who have bipolar disorder or who have schizophrenia, that's one of the things that we do is create a safety plan and a safety support system. So people who, even if they lapse into a manic episode or a psychotic episode before they realize it's happening, there's somebody that they interact with on the regular that's going to notice and be able to identify it and help the person take the steps they need to stay safe. Going back to working with patients every day, creating healthy boundaries is really important. You say sometimes going to work every day, their behaviors start to affect you negatively. And so I would, again, that's an area where I would really suggest talking with your supervisor. So you've got some strong supervision to help you set those boundaries and look at, really define in what way this person's behavior or lack of progress or whatever is affecting you negatively. Is it causing you to feel hopeless and helpless? Well, why is that? And what parts of that situation do you have control over? Is it that when you get out of sessions with people all day long who are in a negative mindset, that you feel exhausted and negative and pessimistic? Okay, well, maybe there is a need for debriefing or de-escalating and reframing. I know when I used to work in a clinic, I would call my husband on the way home. We had 2 small children at home. I wasn't going to sit there and take time away from them, but I would call my husband and debrief on the way home. I'm obviously protecting confidentiality, but I'd vent. I'd be like, oh my gosh, it was such a frustrating day today, blah, blah, blah. And that helped me get reframed, focusing on, there was a lot of stuff I couldn't control. And I'll admit it, I'm a control freak. So it's hard for me to not be able to control. But I can't. So, okay, that's fine. Let's take a look at what happened and what did go well. What did go well that day? And a lot of times that's one of the things I'd forget. And my husband was good at reminding me. He's like, okay, I'm hearing that it felt like a shitstorm today. What did go well? And there was always something. There was maybe not all days were equal, but there were always a few things that did go well that day. And even if it wasn't stuff that went well at work, recognizing that there's more to my rich and meaningful life than work was always important. Recognizing that I had 2 lovely little children at home. I had a mess full of animals at home. I had him at home. I had a home. Those were all things that I was able to turn my attention to and go, okay, maybe my day sucked. And I'm over here. And how grateful am I that I'm not feeling as oppressed and unsafe and powerless as a lot of the people I saw today. And, having a moment of gratitude was helpful for me. Now, that's not helpful for everybody. But if it is negatively impacting you, you need to define specifically how it's negatively impacting you. Your desire to go to work, and your motivation. Well, that may be not feeling fulfilled. That may be not feeling like you're making progress. So a supervisor can help you identify where you're making progress and can help you do things that may improve your sense of fulfillment. Like I said, they may give you new assignments. They may send you a training. I don't know. If it's negatively impacting you emotionally, you feel depressed and just over it, it's important to debrief. And also, again, a good supervisor is there to say, all right, let's talk about what's going on. Maybe we need to lighten your caseload or switch you over to just intakes for a little while so you can get a breath. Not everybody is wanting to do individual therapy 6 hours a day, 5 days a week. I know I don't. It's too intense. It is too exhausting, in my opinion, to do that. I always preferred having a mix of groups and individuals. Can I speak about urge surfing techniques? It's supposed to help with cravings, but for me, impulse always seems to be overwhelming, and sooner or later I cave. Okay, that is a big question. And yeah, urge surfing, most of the techniques we talk about in counseling, they're not on-off switches. And I wish they were. Urge surfing can help for people recognizing that the urge will come in and it will go out. I have found for when I'm feeling an urge that I don't want to act on, it's important for me to acknowledge it, recognize that it will increase in intensity for a little bit and then it'll go out, and turn my attention to something else. So if I'm having an urge to eat the chocolate cake that's downstairs, all right, it's 9:00 at night, probably not the time to go eat, a fourth piece of chocolate cake. So I need to turn my attention. I'm like, oh, it's calling my name. It's calling my name. I want to go down there. But then I start focusing on something else. I may splash water on my face. I may I may start playing a game on my phone. I may call somebody. It usually 15, 20 minutes. And then before the urge starts to subside, or noticeably subside. But then that little sucker may come right back 15 minutes later. And being okay with that and saying, all right, we're going to do it again. Urges, unfortunately, are kind of dopamine driven. It's your body saying, I want you to do that because it's made me feel better or it's helped me survive. And so for people with addictions, for example, they may have the urge to use. Well, their body's going, hey, I don't have enough dopamine. I'm feeling low. All my neurotransmitters are kind of out of whack. Just do that. It'll make you feel better. So there's the urge to feel better. Yes, it's an urge. But we don't want to act on it because we know in the long run it's going to make us feel a lot worse. So we turn our attention to something else. And recovery, for most people, myself included, some days is minute by minute. It's not day by day, like they tell you. And sometimes those urges will be stronger. If you're vulnerable for some reason, you're sleep deprived, or you're stressed out for some reason, those urges may be stronger. If you're in an environment where you're being triggered a lot more, your urges may be stronger. And this is true for any behavior, not just addictions. Urge surfing, the way I use it, now Linehan has a slightly different approach, but the way I use it is just recognizing that urge is going to come in and it's going to peak and it's not going to be so comfortable, but it's going to go out. And while it's doing that, I'm going to be doing something else. So I'm not focused on it, because the more you focus on it, the more you focus on the intensity of that urge, the more you're feeding it, the more power you're giving it, the more energy you're giving it. Don't focus on it. Eventually, urges will get less frequent, less intense, and last less time. So intensity, frequency, and duration will all decrease. When you're not reinforcing that, when your body says, I want you to do this, and you don't do it, eventually your body will say, you know what? Okay, don't need it. The best analogy I can make, and it's not an exact analogy, is a child who wants candy. And they ask for the candy, they ask for it nicely, and the parent says, no, not going to have it. Well, the child starts getting louder. And this is our inner child, if you will, saying, I want it. And the parent says, no. The child gets louder. That's that urge. I want it now. Parent says, not going to have it. Now, if the child starts getting really rambunctious and the parent's like, oh my gosh, you're embarrassing me. Okay, here, take the candy. Well, then the child has learned, well, I just got to pitch enough of a fit and they'll give in. Or if they give up and then 5 minutes later they start in again, and the parent gives in the second time or the third time or the fourth time, the child is learning, I can wear them down. When the parent doesn't give in, the child learns, hey, I can't wear them down. There's no point. And that's the best analogy I can make for how urge surfing helps a lot of us deal with urges, especially in early recovery, because we are silencing that part of our brain that says, I know how to make myself feel better right now, real quick. And, sometimes that's not the best thing in the long term. Make a list of things that you can do to redirect your attention. When you feel that urge coming on, or you notice that urge, okay, that's when you stop what you're doing and say, all right, this is going to be distracting to me, so let me turn my attention to something else. And it can be frustrating if you're at work, for example, and an urge hits and you're like, but that urge is loud. That urge often will not quiet enough for you to do your job. Then it starts getting really frustrating because you hear that urge screaming in your ear and you're trying to focus on the Excel spreadsheet and it just ain't working. Which is why I say turn your attention to something else. Something that will actually occupy your attention and you can engage in it for long enough for that urge to go away. Talking to somebody, call your sponsor if you have one, call a friend, find a game you can play, take your dog on a walk, something that you can do that can help you get to safety. And that's the other thing while we're talking about avoiding urges. If you are doing this in terms of relapse prevention, making sure that you get to safety is really important. If I'm sitting in my house and I know that my drug of choice is downstairs and I'm like, oh, I don't want to go use, but it's right down there. That's not a safe environment. I need to get to safety. So I need to go somewhere else. I need to go to a meeting maybe. That's important. Ideally, I wouldn't have the trigger in the house anyway. But making that point, not everybody can avoid it. People who have eating disorders, people who are addicted to pornography. There are a lot of behavioral and other addictions besides just illicit drugs that you may not be able to completely eradicate from your house. So getting to a place where you're safe, where you're less likely to engage in the behavior. We'll stick with the chocolate cake. If you're craving, devouring that chocolate cake that's in the house, okay. Well, sitting in the house is probably not the safest place. So getting out of the house where you can take the dog on a walk, go on a drive. If it's late at night, you're not going to want to walk the dog. It may not be safe. Okay, go on a drive. Maybe take the dog with you. I don't know. But there again, you're not sitting there right next to this temptation that is literally a dozen feet away. Oh, goodness. Okay, this skipped on me. Let me go back. Spitting and pinching is what I'm dealing with. Setting a boundary in a logical, redundant way when the client can understand that's unacceptable. And without knowing a lot more about what's going on, they may be able to understand it's not unacceptable, that it's not acceptable, but they may not have the impulse control to be able to implement the strategies you're talking about. For example, working with people with dementia. As their dementia progresses, it's not uncommon for them to become sexually dysregulated. And some of their behaviors can become offensive. They're not meaning to be offensive. And you can tell them, coming over and pinching me on the cheeks, that's not appropriate. And they'll apologize and they'll mean it. And they'll sit down and you'll have a good, hopefully, rest of the session. But by the time you have the next session, they ain't going to remember that conversation you had. And they may come back up and pinch your cheeks again. Or worse. So, but understanding it's not that they're trying to be disrespectful. They don't remember. And they don't understand they may not really conceptually understand why what they're doing is wrong because that's what they did back in their day. It's, again, without having a whole lot more information, it's hard for me to provide any direction on how to handle that therapeutically, aside from really stepping back and evaluating the facts in this context at this time. Can this client understand what they're doing? Do they have the ability to implement the tools that I have asked? And if the answer to both of those is yes, then my third question is, okay, what is their motivation? What's reinforcing or rewarding their continued inappropriate behavior? Do they like seeing me get flustered or upset? Do they get put in timeout so they don't have to deal with other people and there's less stimulation? There's something maintaining that behavior. If they're able to stop. Okay. Well, it appears we lost the stream. Can you hear me? All right, it's back again. Hopefully you guys can hear me. Okay, there we go. There's where we were at. Dealing with toxic coworkers, and I actually have a couple videos on that, can be challenging, but ultimately it revolves around being able to identify and communicate your boundaries and recognize what part of their behavior is negatively impacting you. Is it something that they're doing intentionally to you, or is it something that is triggering past memories from other toxic people in your environment? Okay, Adriana says you can hear me, so I'm going to keep talking. My video is completely frozen, but that's okay. So toxic people oftentimes are very miserable in their own heads, or they don't have the skills and tools they need to communicate assertively or manage their own emotions. And that's not something we can teach them, but it is something that we can recognize and create personal boundaries. There was one person that I used to work with who was a therapist, and she would get mad and she would storm around the clinic and slam doors and scream and just do all kinds of acting out. And a lot of us gave her a wide berth. We couldn't control her, but we recognized that there was quite a bit of impulsivity and anger there, and we would, for our own sanity, we would give her a wide berth. And when she would act out towards us, we would also recognize that a lot of that toxicity was coming from the darkness that was inside her own head, and not take it personally. That was really important. At one point, it did rise to the level we had to involve human resources, but that was for a very specific issue she was having with her office mate. Without knowing the toxic behavior specifically, those are the general tools I would look at, because you can't fix somebody who doesn't know they've got a problem and doesn't want to be fixed. And most of the time, especially with coworkers, it's not our place to try to fix them. Okay, let's see. Oh, and going back to the urge surfing and the sooner or later you give in. All right. Say you do give in. Let's look at, did you last longer? Were you able to resist that urge longer than before? If so, great. You've learned ways to avoid the urge until it doesn't work. So what can you do to strengthen that? What can you tweak to make it a little bit different so you don't do it again? That's what relapse prevention is all about. Every time I've had a client relapse, I've said, okay, what can we learn from this? What did you do that helped you stay sober until then? What changed? And what else? What can we do differently now? What did we miss? In general, gabapentin is a medicine that's prescribed for nerve pain. So I'm not sure why specifically they prescribed that for you. It does tend to have some anti-anxiety properties, but that's generally not the first line prescription. So that would be something to talk about with your care provider, about why they prescribed it, what the side effects are, and if there are any alternatives if you're not finding it helpful. I'm sorry that your mother passed, Richard. Having had depression prior to your mother passing, and now that, it sounds like you were close to your mother, the grief, which involves anger and depression, just is compounding what's going on. A lot of times, people talk about depression as feeling hopeless and helpless and just, they can't do anything. And I would encourage you to talk with a provider, a therapist, a spiritual leader, pastor, priest, rabbi, whatever, or even a trusted friend, but ideally a professional of some sort who can help you examine all of the things that may be contributing to your depression. Depressive symptoms can be caused by hormone imbalances, thyroid imbalances, nutrient imbalances, sleep problems like apnea. They can be caused by chronic stress. They can be caused by grief. They can be caused by insulin, blood sugar problems. There are a lot of different things that may be contributing to your symptoms. Depression and stress itself will also throw all of those things out of whack. So a holistic assessment of what's going on would be where I would really start in order to figure out, okay, what strings can I start pulling to start helping myself feel better? And what am I willing to do? Some people are willing to do talk therapy. Some people are willing to start exercising. Some people want to start taking medication. Depends on what your options are, or what your options are depend on what is causing your symptoms and what you think will be the best place to start. Okay, so Richard, adding to what I was saying about that feeling of hopelessness and helplessness with that family friction. You said your mom was holding everything together. Now it feels like everything's falling apart. You feel less in control, and there's a lot more anger and animosity, which is exhausting. And we can't control other people, and that's exhausting. And it feels like there's just nothing controllable in this situation right now. So working with a therapist, you may be able to identify, what's important in your rich and meaningful life and what aspects of that you can control, as well as, again, I can't emphasize it enough, getting that holistic assessment to make sure that physically there's nothing contributing to your depression. Even minor amounts of sleep loss can significantly increase depressive symptoms in people. So, get that blood work done, go to the doctor, get a physical, make sure everything's working well under the hood, so to speak. Consider anti-inflammatory nutrition, which means eating fruits and vegetables, avoiding alcohol and highly processed foods, or at least minimizing alcohol and highly processed foods, and making sure that you are trying to eat probiotics like yogurt or kefir or kimchi or even sauerkraut. Anything that's fermented can also help your gut health, which can help your mood. In terms of your question, Danny Moy, of how do you know if they've had too much therapy? That's a personal decision. If you feel, or if the person feels like they are continuing to make significant progress toward their goals, great. Therapy is supposed to help people identify or address a problem, identify a solution, move toward that solution, end of story. It's not supposed to be somewhere where you go to vent and get perspective on random things for 15 years. That's not therapy. And quite honestly, I feel like it's unethical when therapists just keep having people come in, even though they're not working on a problem or not making significant progress. Just keep coming in. But that's my belief about what's ethically appropriate. But if the person, some people have a lot of stuff and a lot of issues, and they may continue to make significant progress for months, maybe years, but I haven't seen that. A lot of times therapy is much more effective for people with significant mental illness if it's episodic. Even people with schizophrenia benefit from therapy, but episodically. So they have a problem, they go to therapy, they identify what the solution looks like, where they want to go, they solve that problem, get to that solution. Okay, we're good. And then when another problem comes up, if they need to go back into the therapy, then that's what they do. So there's no hard cutoff for what is too much therapy. It's really, is this beneficial? Is this helping me move toward my rich and meaningful life in a meaningful way? Or is it just kind of something to fill the time? Or have I created a dependency with my therapist and I'm using them as a surrogate for a friend because I don't have friends that I can trust in the world? So that would be my answer for that. Okay, everybody, it has been a wonderful hour, and I will talk to you. I won't be doing a live next week. It's going to be between Christmas and New Year's, but then we will get back to doing things beginning in January. So I will see everybody next year. Have a great holiday season, or I hope you had a great holiday season if yours is already over, and I will see you in 2026.